विग्रहा त्रिनयना माणिक्यमौली स्फुरत् तारानायक शेखरा स्मितमुखी मापीनवक्षोरुहा पाणिभ्यामलिपूर्णरत्नचषकम् रक्तोत्पलम् बिभ्रति सौम्यां रत्नघटस्थरक्तचरणां ध्यायेत् परामम्बिकाम् सततज्वर विषमज्वर ग्रह नक्षत्र दोषाञ्चान्या हर हर काली सर सर गौरी धम धम विद्ये आले माले काले बन्धे भज भज विद्ये मख मख विद्ये नाशय नाशय पापम् हर हर दुःस्वप्नम् विध्वंसय विध्वंसय
Namaste, Suprabhatam, and a warm welcome to each one of you who have joined us this session this morning. Today is the 11th day of the Global Festival of Yoga that started from 21st June, that is International Yoga Day. On this morning, or this noon or evening as the case might be, we are pleased to present in front of you Ms. Smitha Mallaiah. Smitha ji, request you to kindly join us. It's a great joy and pride to introduce Smitha ji, as Smitha ji is a good friend, a young achiever, and a very dynamic personality. Ms. Smitha Mallaiah works as a senior mind-body intervention specialist at the University of Texas MD Anderson Cancer Center's Integrative Medicine Program. She also serves as the Program Director at SVYASA-USA Houston Center. At MD Anderson, she is involved in developing and teaching yoga research interventions for different cancer populations like breast, lung, and brain cancers. She also works with the couples going through a cancer journey using yoga and meditation. On the clinic side, she works alongside other integrative medicine clinicians, seeing inpatients and outpatients going through cancer from diagnosis through end of life using yoga therapy. She has co-authored yoga publications and has presented her work at national and international conferences on the efficacy of yoga in cancer care. Smitha has been practicing yoga therapy for specific ailments for over 15 years at various hospitals and clinics. Some of her special areas of expertise include cancer, children with special needs, pre and postnatal care, post-traumatic stress disorders, and others. She has conducted many yoga teacher training programs, yoga therapy training courses, and personality development camps for children, retreats, and other courses at SVYASA Houston. Today, she'll be presenting on a very pertinent and interesting topic, that is wellness in cancer, from surviving to thriving. Today, cancer has touched many of our lives directly or indirectly. In this presentation, she will be sharing the application and scope of yoga therapy in cancer care. Of course, wellness is something that we seek as a positive state, but no life situation can be left out of its ambit. Therefore, the whole purpose of the sessions here and the entire program of the global festival is to see how can we seek, how can we rediscover this wellness in all life situations. And during the cancer care also it becomes extremely important. In her experience for over a decade, she is seeing patients benefit tremendously from yoga therapy. Yoga therapy can be applied anytime from diagnosis, during treatment, to survivorship, to help patients not only manage cancer, but to thrive. And that is the topic of the presentation today. She'll be speaking on wellness in cancer, from surviving to thriving. Thank you, Smitha ji, for joining us this morning. Welcome.
Thank you, Vinay ji. Very, very thankful, and I'm extremely honored to be here. And before I begin, I would like to congratulate and extend my wishes to Team Indica for organizing such an amazing, true festival of yoga. And what a joy to be part of this, especially the global yoga family. And special congratulations to Dr. Vinay Chandra Banavati, Anuradha ji, and Team Indica for putting together. And to begin, I'm truly honored and humbled to be here to share some of my experiences.
Just if I can intervene for a moment, I would like to add, Smitha ji was my instructor when I did my yoga instructors program at SVYASA Bangalore 15 years ago. It's been a remarkable journey since then. Thank you, Smitha ji, for joining us.
Yes, that was the beginning where I was the instructor, but since then, definitely there has been a lot of learning, and I take Vinay Anna as my mentor and guru as well. So let me get my slides up. If somebody can confirm if the slides are up, I'll get started.
Slides are visible.
Namaste, everyone. So I extend my greetings from Houston, Texas here to all the viewers of this session who are here, and warm greetings and congratulations to the Global Festival of Yoga family. Today, as Dr. Vinay Chandra mentioned, the topic that I will be presenting, or I will try to address, is wellness in cancer, from surviving to thriving. And I think the introduction that I wanted to, which Vinay ji beautifully brought out, is whenever we think about wellness, we think of wellness as something that is completely away from illness, disease, or death. So also the notion that when you have a disease, especially a life-threatening disease like cancer, wellness is, rarely sought out. I'm barely trying to survive this disease, but how do I look anywhere further and beyond? But something that is very interesting in my experience, working with hundreds, if not I'm counting my 1,000th cancer patient working here, the experience has been tremendously fulfilling to see how the nature of life, which is to thrive, is always active and continues to thrive, and how yoga as a therapeutic application can aid in this process. And I will try to share some of the experiences along this idea. So the outline of today's presentation will be a very basic understanding of yoga and yoga therapy. I tried to take this away knowing that a lot of our viewers probably would be yoga teachers, yoga therapists, or yoga enthusiasts, but just wanted to bring that in so that we can build the idea and understanding on that. And of course, we'll go through some risk factors for cancer, and not necessarily the risk factors just at the physical level, but risk factors going beyond with a yogic understanding, bringing the risk factors from the panchakosha level, and yoga through cancer journey, various stages of cancer. Some quick research updates from MD Anderson, which I'll not be going in deep. We will have Dr. Lorenzo Cohen, who will be presenting in few days, and he will bring in more details on the research aspect of it. Some clinical practice guidelines for yoga therapy, which will be very important and useful for yoga therapists and people in the field to know that what clinical guidelines are coming in, especially for the field and area of cancer. And some case studies, which is what is my favorite part, to go through client's journey or patient's journey to share. So when we talk about yoga, again, I'm not trying to preach to the choir, but a basic understanding and definition of yoga, definitely understanding yoga from beyond the physical level, where we have beautiful definitions of yoga coming in from Yoga Vashista, like Manaprashamanopayaha, from Bhagavad Gita, like Samatvam Yoga Uchyate, from Patanjali's Yoga Sutra, Yoga Chitta Vritti Nirodha. All these definitions, very importantly, pointing to the state of mind and the unification of mind-body in the process or in the journey of yoga. And many a times we see that the application of yoga is limited to a physical aspect, a posture or asana, but this is where the important transformation continues to happen, where the recognition of yoga as a holistic science becomes important. And when we talk about basis of yoga therapy, I'm a graduate and alumni of SVYASA Bangalore. So the beautiful concept of integrated approach of yoga therapy as developed by Dr. Nagendraji, Nagratnaji, and others brings out the most beautiful aspect of how a personality can be addressed beyond the physical level with Annamaya, Pranamaya, Manomaya, Vijnanamaya, and Anandamaya levels. So because of this important contribution of the Taittiriya Upanishad, we can apply yoga therapy so beautifully and effortlessly, and all areas of patient needs can be addressed. And if I can add or say that this would be the key missing link in modern medicine, where the approach is limited many a times, most of the times, to the physical aspect or the addressing of the disease and symptoms. When we look at and understand cancer, we see various risk factors for cancer. And of course, we all have exposure to most of these or many of these risk factors, but only few of us develop cancer. So this is where the understanding of the Panchakosha, where the role of mind is emphasized. Even though we all have exposure to various risk factors, the adhi, or the imbalance that begins at the mind level, manifests as a disease at the body level. So looking at some risk factors at the physical level, we see that there are a lot of environmental risk factors, which through policies and care, through various federal programs or government regulations, we see the carcinogens like, asbestos, which was there in most of the building materials, is now taken out. But we still have tobacco, it could be alcohol, other chemicals that are still there, which can be carcinogenic to the body and can promote cancer growth. We also see unresolved trauma. There is a lot of literature that is coming out when we talk about trauma or PTSD, post-traumatic stress disorder, which is one of my very interesting areas that I've been trying to study and understand as it applies to yoga therapy, because the role of mind and the role of trauma on the mind and body is again something that can promote cancer growth in the body. Of course, we know genetics. A lot of times people do argue that, cancer has nothing to do with mind, it's so much more. Of course, it is so much more, and we have genetics and other predispositions also contributing. But again, the switch that turns on the growth of tumor and cancer in the body can be totally impacted by the role of mind, stress, and others. We have other dietary causes, sedentary lifestyle causes that we see, exposure to radiation and other harmful chemicals in the environment, pollution, pesticides, and others becoming a major risk factor for cancer at the physical body level. Moving on, at the energy level or the prana level, a lot of these physical imbalances, of course, as well as the imbalances of the mind or the manomaya kosha, disturbs or impacts the pranamaya kosha, or loosely translated as energy level or life force level. So we see, major pranic blockages in the nadis, many times dietary imbalances causing, lack of pranic force in the body as well, and many different lifestyle patterns causing blockage or deficiency in prana as well, which can be a risk factor. Moving on at the mind level, which is one of the most important areas when we understand and apply yoga therapy. Even at the Panchakosha level, the mind is a kosha that is intersecting between the Vijnana Ananda and the Anna and Prana. So the decisions and the characteristics of mind can promote healing and thriving, or can negate and become a negative behavior to cause disease at the body level. So most importantly at the mind level, as my guru, Dr. Nagaratnaji says, the uncontrolled monkey mind that continues to be distracted and cause trouble. And with Patanjali, we understand with kleshas and other, predispositions of vrittis at the mind level, basically uncontrolled high stress for an extended period of time, becoming a burden to the mind, which can manifest as a disease at the body level. Powerfully emotionally charged traumas, again, coming back to the trauma and impact on the mind, a lot of traumas, especially childhood events or childhood trauma, can actually impact the adulthood and the health and well-being, and the cancer risk in adulthood can also be dictated with traumas that can be long-standing at the mind level. And of course, inappropriate ego defense mechanisms, where whenever we look at stress, we say that stress was developed to protect yourself from the tiger. We don't have a real tiger in our lives now, but we have the tiger in the form of stress that continues to linger around always. And when you look at the cancer research, another important idea to understand is there is more literature to support that the stress and the imbalances at the mind level can actually negate or take away the benefits of healthy eating and exercising. We see a lot of patients coming in, I have always eaten organic food, I'm an athlete, I work out, why did I get cancer? It could be because the idea of the role of mind is not addressed, stress management or mind management has not been addressed, which is a crucial part of yoga therapy in cancer care. At intellect level, again, wrong perceptions, deep-rooted wrong notions, thoughts, phobias can all contribute. Most importantly, it is limiting the ability to be in touch with the higher center, higher power or intellect, which is very important for us to make right decisions and take care of health. So again, a very common, important slide that most of my Vyasa friends SVYASA friends will be knowing that when we look at these panchakoshas, or the 5 layers of existence, we have our nature, which is the nature of each of these layers to be in. And due to stress, lifestyle imbalances, we go away from this nature. And when you look at the practices of yoga therapy, and when I say yoga therapy, the holistic approach of yoga therapy with all-rounded practices, these practices can help an individual to come back to nature, which in turn can support healing. So these are various practices, just to make sure for people who are new to this idea and concept. When we talk about yoga, it does not limit the practices at the physical level, the practices of the prana, the practices of the mind, the practices and ideas at the intellect level are also important to have all-round balance at the personality and to create and promote healing. So when we look at that essence of yoga therapy, what are we looking at? It is really, with Patanjali's Yoga Sutras, Patanjali in the Ashtanga Yoga talks about the journey from beginning from yamas and niyamas, which becomes important today in the COVID situation. Shaucha would have been the most appropriate thing with that sense of cleanliness. And of course, not just at the physical body, but beyond. But these successive and progressive steps of yamas and niyamas leading to dharana, dhyana, samadhi. But the essence and important point to take away is the silencing of the mind, to really get in touch with the self. And in the process, you have klesha tanukarana, taking care of all the kleshas, asmita, avidya. And this process is a conscious, mindful journey that the patients are going through. And the tools that are needed are definitely beyond the physical asanas or postures. When we look at cancer, since this is all about cancer, and I'm not an oncologist, I'm not a medical provider, it's not in my scope to educate on cancer, but with a very simple basic understanding of cancer, it's a group of diseases that has uncontrolled abnormal cell growth, and which can potentially invade, spread, and become disease, metastatic disease in other parts of the body. So what's the impact of cancer? When we talk about cancer, many a times, if you or your family, or if you're somebody close to you have not been impacted by cancer, the idea is, oh, I have nothing to do with cancer. This also could be many a times because of the fear of cancer, guilt or shame of cancer. We see this a lot of times. Patients would not like to disclose a diagnosis of cancer because they are not equipped with how to handle or have a discussion with their family or friends about the disease or about the kind of help and support that they would need from their family and friends. But the outlook or how cancer is going to grow and impact us doesn't look very promising. It is, the statistics say 1 in 2 men and 1 in 3 women will be exposed, diagnosed with cancer in their lifetime. So eventually, with the changes in the environment and lifestyle that we are having, we are all going to be exposed to cancer in some way or the other. And when cancer is diagnosed, cancer has a ripple effect. It is not just the patient, one person who is going through cancer. For many other diseases, it can be so that if I am diagnosed with a heart disease or another disease, I might be going through, and of course it impacts my family a little bit, but cancer has much more stronger impact, not only on the individual, but on the family and on the community at large. We see sometimes with environmental accidents like gas leakage, radiation, sometimes many people in a certain area or community are diagnosed with cancer. And if you listen to the stories, or if you are aware and working in the area, you only know the burden and fear and shame and guilt the disease brings in people. So again, when you look at the impact of cancer, something else that cancer patients go through, which is rarely addressed, is the emotional response and impact on cancer patients. And again, the research points to if there is unresolved emotional distress with cancer patients, it can impact both morbidity and mortality of cancer patients. Again, it becomes important because even though so much money and time and energy is spent in treating diseases, if there is no holistic approach, it can be in vain and patients can still be suffering and families can still be going through the impact of cancer. When we talk about the journey through cancer, a lot of times people may not understand the whole idea and scope of the cancer journey, but just to very quickly put it in a quick glance, we see that the cancer journey starts at the diagnosis. And sometimes you might have patients who are predisposed to cancer, so their fear for cancer may even start before diagnosis. But from diagnosis to treatment phase through survivorship, and you do see people surviving cancer and living long years, 5, 10, 20, 30 years. Cancer survivors are there that I have met and I have seen who are living healthily. And sometimes depending upon where and how the diagnosis, at what stage the diagnosis and cancer journey begin, can dictate the survivorship and the longevity of the patient. And sometimes patients may have recurrences, relapse, and can progress towards what we call as end of life or palliative hospice care as well. So when a patient is going through this journey from diagnosis to survivorship, something that is important for us to understand is the journey of cancer itself is traumatic. And when we understand, again, trauma, it used to be understood as a life-impacting event where a person was restless, did not have options to respond or change, things like a natural disaster. We saw work with the tsunami survivors in Andaman and other areas where, PTSD was high and yoga therapy work was done. Going through cancer is equally traumatic. And most importantly, it decreases the quality of life of the patient and family members many times. So when you look at this spectrum, which is so huge, which can be few months to sometimes years, the scope of yoga therapy also can be understood. Since this is such a long journey, yoga therapy has more role and contribution to make. So when we talk about diagnosis, let's very quickly look at usually, how does diagnosis, how is diagnosis looked at? So a lot of patients, when they get cancer diagnosis, they use this word or phrase called, I received a death sentence. And that was the shock and the impact that cancer diagnosis created on them. And sometimes how the message was delivered is important as well. This hopefully doesn't happen usually, but I've had many patients mention their doctor or nurse left a voicemail for them. Your results came back and I'm sorry to say, but you have so-and-so cancer. So this itself, the receiving the message and how this is delivered can be traumatic for cancer patients or families. So more care and more care is taken in how this message is delivered to patients as well, and support from family and friends. Again, cancer is such a disease that if one is not exposed to the disease, then patients, family or friends may not know how to support you through the journey. So you see a lot of friends or family shutting down and not responding, which can cause emotional distress of losing family or friends to the cancer diagnosis, which can be stressful again. And a lot of times anticipation and waiting. What does my treatment look like? When I'm going to go through treatment? When is my surgery? When are my scan results going to be there? Extremely stressful time can be diagnosis itself. And when you talk about yoga therapy can be applied to help patients stay in the present moment. Transitioning from fear to present moment awareness. What are the details I can collect about this? What are the treatment options I have? Can I talk to my friends? Can I get support from my medical team? From anger to self-compassion. A lot of times patients can have aggressive response of anger, frustration, helplessness to diagnosis, and that can be also helped and negated with yoga therapy. And attachment versus, detachment. We hear the stories of great yoga masters and spiritual gurus where a diagnosis of a disease, they were able to detach themselves from the body and they were able to go through procedures without anesthesia, or they were able to address the body in terms of my body is suffering, it's not me that I'm suffering. And when we look at this from a Western psychology perspective, one of my friends once said, oh, that's denial, you're denying that you have a disease. But in a yogic way, it can be a very healthy coping mechanism. So you don't identify yourself with the suffering and the pain that you go through. And I personally have used this with many patients. And the moment they get that idea to be able to detach and look at themselves with compassion, with kindness, you can see that their pain and anxiety levels around the experience of the disease or symptom can go down significantly. Creating this ability to witness the process of going through the cancer, and most importantly, can we involve the patients as their own warriors so that they take responsibility and become active, engaged members in this process going through cancer, rather than being detached or having difficult time accepting and going through this. And most importantly, from the yoga therapy perspective, can we develop a sankalpa, a strong, willpowered statement that they can use going through all their treatments and various yoga practices. When we look at cancer treatment, again, you see that various treatment options are available. We used to see that surgery, chemo, and radiation used to be the standard of care, but not anymore. With new invention of various therapies coming on, we see that more and more newer therapies are offered for various different types of cancer stages, or if it is a pediatric case versus a adult person who is going through cancer. So when we talk about after the diagnosis state, which is a state of basically prehabilitation, this is right before the moment or the beginning of the treatment phase, where the patient is probably still getting ready to go into treatment. So this prehabilitation is basically an approach that is used in surgery, where you prepare a patient really well before the surgery. So when the patient goes through the surgery, the patient comes out actually better out of the surgical process, or basically heals faster or better. So we can use the exact same model with prehabilitation and yoga. So prehabilitation is a practice where we enhance patients' functional and overall capacity. Since yoga addresses the individual beyond the physical level, we also can use the mental and emotional components of yoga to prepare the patient go through the treatment as well. And as I read, a teachable moment where this can be really where we are empowering patients to take the charge, wherein on the contrast, it would be, I am helpless, I am at the mercy of somebody else to make decisions, and I don't have control over the situation that is happening. And this loss of control over the situation is what is the needle that guides into the traumatic experience. So empowering patients to take charge, to make the lifestyle changes, to prepare themselves go through, can be not only a physical help, but also at the emotional level, it can address a lot of gap that is still in the cancer care. During treatment, there are a lot of symptoms, and the list that I have here is not just an exhaustive list. So many symptoms, but not limited to, shortness of breath, pain, fatigue, lymphedema in patients that might have their lymph nodes taken out, permanent scarring, adhesions, limited range of motion, osteoporosis, nausea, constipation, the list goes on and on. Again, you can see some of the symptoms are more physical, wherein some are into the energy and the mental aspect of it, where cognitive dysfunction, anxiety, depression, all these are part of the burden that comes during the treatment. Most importantly, also not to forget that not only the patient is going through these burden, but the social burden of cancer on the family and caregivers, the loved ones, can be huge as well. And in a moment, I'll be coming to the caregiver and the family, how it impacts the cancer patients and their journey. So during treatment, when we look at yoga therapy and its application, when we look at yoga therapy and its application, yoga therapy goals can be aligned with the oncology team goals. We see a lot of patients where the expectation is that post-radiation, there is going to be scarring. Post-chemotherapy, there's going to be weight loss. So there are many goals that the care team can have. If you can get, if you are part of such a care team where you can work with the clinicians, yoga therapy can be used to align and empower many of these goals that are that can help them to go through. So apart from that, physical, mental functioning and quality of life also can be definitely emphasized. Healthy coping strategies can be brought in with maybe small practices, with even brainstorming and bringing ideas, and again, continuing to develop that strong sankalpa to empower patients through their treatment. And in this treatment area is also where we see a lot of research pouring in. And these are few papers from the research from MD Anderson Cancer Center, where these first two studies that you see were done in the area of breast cancer patients. And again, going back to my roots of SVYASA Bengaluru, where these studies were done, and the impression of these studies was what basically started some of the work at MD Anderson Cancer Center here. So there are studies, many in the breast cancer especially, and during treatment that talks about the benefit that yoga can bring in. So in one of the study where we found that yoga group, actually women going through yoga during their breast cancer treatment, have better physical functioning, and they have better overall quality of life, and they also excelled in benefit finding. This is one of the very important and key areas when patients go through cancer. A lot of them are still puzzled of why the cancer experience, and the literature suggests that patients who can actually make meaning out of their cancer experience have better longevity and better outcomes and prognosis with cancer after the treatment is done. So yoga can help even in that area. There was also another follow-up study that was done using stretching and exercise as a comparative. This was a randomized controlled trial. And a lot of times we see, yoga is as good as exercise. Why do I have to do yoga if I do exercise already? So in this study, the finding was that yoga group actually excelled far better than the exercise group. They had some very common outcomes, maybe in physical functioning, but yoga group did way far better with their mental health and their spiritual health and making meaning through cancer experience. I also have another study that I've put in where during the treatment, another experiment that I was part of was delivering mindfulness meditation. In other words, breath awareness meditation, simple meditation practices during stereostatic breast biopsies for women who are going through breast biopsies for a diagnosis purpose. So again, this is a diagnostic measure, but even within this small study, we found that patients benefit in terms of pain, anxiety, if they use these techniques before their procedures, during their procedures, or post-procedures. This just speaks to the amount of scope that yoga therapy has during treatment when we see. Another area that we explored, and I was lucky to be part of with Dr. Catherine Milbury's work at MD Anderson, is bringing yoga and yoga therapy to patients and their caregivers. Of course, we had some patients where their spouse or husband and wife were basically the caregiver. We also had other family members like son, daughter, mother, various family members that could be the caregivers for patients. When we talk about the social burden of cancer, again, there is high caregiver distress and symptom burden in the caregiver population. And if the caregiver is stressed, it impacts the patient, and the patient stress impacts the caregiver back again, which creates a very vicious cycle. And intervening with yoga, including both parties, will be another excellent idea or an important area to work in. Some of this work was impressed by Dr. Aarti Jagannath's work at NIMHANS, where she did a schizophrenia study including caregivers. So there's been a lot of inspiration and cross-pollination from SVYASA Bangalore and some of the work at MD Anderson. What are some of the clinical therapy practice guidelines that we have for cancer? So I know yoga therapy, we all understand that yoga therapy is a growing field into different areas, but I personally believe that cancer is one area that is more prepared and the changes might happen much faster because of some of the clinical practical guidelines that are available for this. So this is American Society of Clinical Oncology, ASCO, endorsing yoga for breast cancer population, which came out in 2018. And again, there were specific key recommendations for this population where meditation, stress management yoga were specifically recommended for anxiety, stress, mood, quality of life, anticipatory nausea, and others. And NCCN, which is National Comprehensive Cancer Network, which releases guidelines on many of the interventions that impact cancer care, recommends yoga as a category 1 treatment for cancer-related fatigue, which is huge. Again, there is fatigue is a huge area that impacts cancer patients' quality of life, and yoga is recommended as a class 1 treatment for it. We also have the recommendations for anticipatory nausea. Yoga, if it is approved by physician, can be used in cancer patients. We see distress management guidelines that came out in 2016. That is, again, recommending yoga relaxation practices for distress in cancer patients. Now moving to end of treatment or survivorship time. So whenever patients finish their cancer treatment, one of the very classic lines that they hear from their medical provider, depending on which cancer, but most of the cancer patients is, okay, we'll see you in 3 months, we will see you in 6 months. And there is not necessarily a definite guideline given to what do you do in these 6 months. You know, you don't have to do anything. Go about, live your life normally, and everything will be fine. We'll see you in 3 months or 6 months. And then we see that there is lack of support in this time, transitioning into the new normal, because their new normal after cancer is something that has completely changed, because patients could be living with chronic disease. Patients might have change in their appearance, their body parts might have changed, and how their function could be different. So most importantly, now the patient who was under the care of a medical team is not going to have any care for 3 months or 6 months, can be very fear-provoking in these patients. So bringing yoga therapy into this time of end of treatment and survivorship, where the goal is to provide support for patients and caregivers and families going through, definitely continuing yoga, which can also aid in managing a lot of symptom burden that is still lingering around from the post-treatment effects that are there. And most importantly, to make the journey to make meaning or find meaning in their cancer experience, and social engagement and finding their new normal becomes important. We also have good amount of data and research in the area of yoga in cancer survivors. And again, this is an article by Susan Danhower, which says that how much cancer patients are looking for alternative complementary therapy, and yoga is one of them, and the safe integration is something that we all have to work with. Now, through this whole cancer journey, something again, as I mentioned a couple of times already, is the trauma of the cancer. So there used to be an impression trauma is related to, war veterans, trauma is related to maybe a physical abuse, rape victims, or natural disaster victims. But more and more, we see that the trauma of cancer itself is an area that is growing, and there is more light shed in this area. And basically the trauma is an emotional response to the long-lasting impacts that often leaves the individual disconnected, and it also disables the person to move forward. Also with cancer, something that is disheartening to know, if there are patients who have trauma before their cancer experience, it can amplify the trauma post-cancer experience. Also, we see that adverse childhood events, which could be the shock for children or the trauma when we were children, if those are present, it also enhances the risk to develop cancer in adulthood. All this again and again to point that the role and understanding of the science and philosophy of yoga has placed so much importance on mind because it creates the vasanas, samskaras, the memories, the impressions, and the role of that on health and well-being is something now the Western medicine is grappling and trying to get an understanding of. So as I understand and experience, patients might have survived the disease, but they might not just have survived the experience itself. A huge scope for yoga therapy to intervene to help patients connect. And why cancer patients come to yoga? For various reasons. Sometimes they may just show up because they're seeing that yoga can be used in cancer care. So there is a hope because many times patients are exhausting their options of treatment and they would like to try anything and everything that is available. But sometimes patients can also, in a very mindful way, be present to have that sense of complete, integrity and finding meaning in this journey that they are going through. And again, this is different to everyone, and everyone's journey is absolutely, respectable. So in the last few minutes that I have, I would like to present a few cases and how yoga therapy might have helped them through the journey. So in the first case, this is, Miss A. She's a 72-year-old female who came to yoga therapy. She was diagnosed with an invasive ductal carcinoma, had high symptom burden on her symptom assessment scale of pain, anxiety, and others. She was unable to keep up with her routine work and walk and things like that. And she had never practiced yoga therapy. And most importantly for this patient, that was challenging for her to even go through the treatment of cancer was she was extremely claustrophobic. So, and phobia is basically the fear of small spaces. And if you're aware of cancer treatment, the radiation therapy is a space where you're basically left alone by yourself to get the radiation to the tumor bed. So she had started her treatment, but the radiation technicians and doctors had tried 2 or 3 sessions. Even with anxiety medication, this woman could not simply stay there to get the treatment. So the treatment itself was something that was right there available, but she was not able to get it. So when she came to yoga therapy, we started with some anxiety management through yoga practices of breathing techniques, calming pranayamas before going into radiation. And within very few sessions, which was about 2 or 3 or 4 sessions, she was able to go get her radiation treatment started. And again, this is something that probably we can't measure because this was part of a research study and we were measuring other things that were related to cancer. And this was not necessarily part of that. But then there are other, information, other benefits or side effects, if you can call, of yoga therapy that are happening as well. So she was extremely pleased and happy that with the practices of yoga and to a point where in about her 2nd week, she was able to get radiation even without her anxiety medication. So it passed and we continued to do her therapy for about 8 weeks in total. After about 4 weeks, she came, to her follow-up yoga therapy appointment. And then she was like, "Oh, Smitha, you won't believe, yoga saved my life. Yoga saved my life." And she was so excited and wanting to talk about. When I heard her story of what had happened, she mentioned that the previous evening she got stuck in an elevator. And you can only imagine if you're claustrophobic and you got stuck in an elevator for almost about an hour. And in her own words, she said, "I was surely dead if not for yoga." And stuck in that little elevator, she did her whole yoga therapy program with all the breathing and meditation and totally connected to herself for a whole hour. So that's what she said. So yoga saved my life, not only through the cancer journey, but she was able to overcome the fear. And she was a woman who would never sleep without her lights on. So through the yoga therapy journey, she was able to overcome not only her fear, but was able to connect to herself in a way much better. This next case is a patient, is actually a couple who came for yoga therapy and who were going through cancer. This was Mr. J. He had squamous cell carcinoma of the throat. And if this is the treatment, you get a lot of radiation surgery followed by radiation, which can impact the ability for you to move your neck, the ability for you to drive, swallow food, a lot of symptom burden in head and neck cancer patients, basically. Also, the patient was going through a very strong emotional reaction of, why me? I am successful, I'm athlete, I have taken care of my health, I work out, why did I get cancer? So there was a lot of aggression and anger, and the wife was trying to support the patient, was also going through significant distress because she also had fears of losing him, and the stress that he was going through was basically making the whole situation worse. So when they came to yoga therapy, they were able to with the yoga therapy, we were able to give them practices and exercises definitely for the neck. We used a prehabilitation model where we were doing a lot of practices where the movement of the neck, the scoring, the swallowing exercises, the practice of Jalandhara Bandha, and various practices that are related to the bandhas and mudras were used, which were extremely beneficial for the patient. And as far as using a couple-based approach or a caregiver-based approach, we were doing practices where we were encouraging interdependence between the patient and the caregiver, so they both feel valued and care for each other. Breath matching, and with the help of my favorite guru teacher Raghuramji, who helped develop the meditations for this from the concepts and ideas of Bhakti Yoga, which was bringing in the loving kindness, acceptance, and appreciation, not only around cancer, but for the couple, for each other. So post 6 to 8 weeks of treatment, we could see actually his range of motion on the cervical spine had improved than when he began, which doesn't happen in cancer patients. They go down, but he not only sustained, he improved it, and also there were significant measures on many other scale. And most importantly, the couple mentioned that yoga therapy was the island of hope, where everything that we saw was so distressing. Coming to yoga was something that was calming and helped us to connect with each other. And something that was very important to know the journey of the cancer patient is from his approach of why me in cancer to why not me. God, and he had a spiritual connection to his God. And he mentioned that I had never questioned when I got the best in life. I never questioned when I was a top lead athlete. I never questioned when I got rich. Why do I question when I get cancer? This also is part of my journey. So he was able to really accept and make meaning with this. And that is where the true change happens, where patients are able to go through this experience in a much more lively way. As we are running out of the time, I'll keep this last case too quick, and this is the last case I have for discussion. This is Miss C. She's a 50-year-old female. She's very young, dynamic. She had stage 3 cancer. She had more symptom burden and was extremely stressed, more migraines, acid reflexes. She had high blood pressure. And during study, it was stressful for her because she had somebody else ill at home. So she was not only taking care of herself, but also the sick family member, and she worked full time. So she had at the emotional level a sense of betrayal from the body, a sense of betrayal from family, hatred and indifference towards cancer cells. And that it was so significant that she would almost talk to her cancer cells like something totally external, and would be angry with herself and the cancer all the time. For her, we had a different approach where the address was much more deeper than just the yoga therapy practices, which also is the extended yoga therapy umbrella, which is diet, exercise, stress management. We had a counselor to support her. So with the yoga therapy help, she was able to, of course, reduce her blood pressure. And something that she found out very early on in the yoga therapy in about 2nd or 3rd week is she found out that the pranayama practices helped lower her blood pressure. So anytime she would get stressed, she would go sit down and start doing Nadi Shuddhi pranayama. So it was such a hands-on, tangible practice for her to experience these benefits as she went through. And her change or transformation was when she was able to also accept cancer cells as part of her own self. The healthy self is me, and the cancer cells is also part of me, even though, you know, I did not want to develop one. So she started taking a gentle approach of loving kindness and caring and accepting. And she said that released a lot of stress and burden, emotional burden from her to be able to, you know, go through and relax and find a calm space. And actually, she was a teaching professor. She quit her job full-time and she has become a health warrior. That's what she calls herself. And she educates people on cancer, healthy living, and making positive lifestyle changes. So when we talk of yoga as a therapy, I know a lot of gurus, teachers that I've been listening even in the Global Festival. You know, yoga was not necessarily designed to be a therapy practice, but it has a huge potential to be so. But most importantly, we see sometimes when yoga therapy is applied, it becomes another form of physiotherapy, or it limits the scope. It's important that we ground yoga and yoga therapy in its core, which is spirituality. And if yoga therapy and its essence of spirituality is separated or removed, then it suffers, or it becomes a mere physical practice, and you may not see the same benefits or effects when you work with patients. Also with yoga, definitely adaptability of the practices to work with the mind through the body. And most importantly, yoga therapy builds on itself. A regular practice continues to give you benefit. And since I'm speaking here from the US, it's definitely cost effective because everything here is about the economy. So it is definitely most cost effective to introduce patients to yoga therapy so their symptom burden can reduce and their quality of life can get better. So if we have to give takeaway, sometimes we get patient yoga instructors, therapists excited to go ahead and start. If you are a yoga therapist or a teacher, a word of caution. Cancer is a very sensitive, complex disease. So safety should become our top priority when we work with cancer patients. So educate yourself, know well, and if you don't, please educate yourself before working with cancer patients, because as much as benefits are there, there can be contraindications and sensitive areas when you work with cancer patients. For patients and survivors, yoga therapy is an amazing add-on component to your journey. And if you're a clinician, you can definitely recommend yoga therapy to your patient by finding the right person, and beginning the journey with the right person becomes very, very important. And as yoga therapists, it is with that sense of compassion and understanding that we take this approach to break the disease or to help patients go through this journey. And again, the idea is not necessarily to heal and cure cancer, but it is to add that quality to the life that patients have. And this applies even in end of life, which I did not discuss today. But even in the end of life, we see that quality becomes important. It's not necessarily the reversal of the disease that everyone is seeking for. My quick acknowledgements to all my patients, my mentor, Dr. Cohen, and MD Anderson Cancer Hospital, and my gurus from SVYASA, and all my extended family members of SVYASA. So with that, I will stop and maybe we can take some questions. Vinayji, my apologies if I went over.
Thank you, Smitha. It was one amazing presentation, laying before us the entire journey of a cancer patient, cancer survivor, or the cancer caregiver, and taking us through the various shades, moods of emotion, the life situations that they would undergo right from diagnosis up to treatment and recovery. Thank you for this. We have many compliments coming from our participants, attendees from all over, and there are many questions as well. So let me present these questions here.
And maybe before I start answering, I will make a disclaimer. Since cancer is a disease which needs to be carefully handled, addressed, If there are medical questions pertaining to decisions with cancer treatment, I will stay away from answering those because it is best for your medical providers to guide each and every patient in that area.
Should I present the questions? So you take a call and which one you want to answer and in what way. You presented in the beginning about the various risk factors involved in causing the cancer. So we have a question from Ms. Anu Joshi, who is asking, how should we unblock the chakras in order to stay away from cancer? You said about the blockage in the pranic nadis or the channels, which could be a factor. So you want to say a little more about it?
So whenever we talk about, again, the Panchakosha model and looking at some of these imbalances and risk factors, sometimes we take it in the literal sense of, can I block something to, stay away or not to have the effect? But it is important for us to know that even at the Panchakosha level, there is this continuous interaction between the koshas that are happening. So instead of taking the approach to only probably address something at the energy level, my approach would be, can we address at the holistic level where we are taking care of not just the physical body and the prana, but also on the mind? Because all these layers are in continuous interaction and they affect each other. And again, I would like for you, Anuji, to watch out for Dr. Lorenzo Cohen's presentation, who will present and actually address a lot of holistic approach into cancer care in his presentation.
Thank you. We have Ms. Ashwini Gambhir, who is asking, it's a personal question as well. My mother or like her patients, so is been diagnosed with ovarian cancer with ascites. How can yoga therapy help people with such a situation?
Again, so as I mentioned initially, each cancer brings its own unique symptoms, challenges. And again, these symptoms, challenges can be unique to individual patients. What patient A with ovarian cancer goes through can be totally different with what patient B with ovarian cancer goes through. But in a blanket approach, something for all of us to consider is the quality of life. And of course, this can improve and include the physical symptoms, but also the mental health, the physical, emotional health of the patient, empowering and promoting sleep patterns so that it can help in rest and healing process with the patients. So various areas can be addressed. I would recommend to reach out to a yoga therapist, and something that I know is SVYASA Bangalore. If you are in Bangalore at all, you can reach out and get professional help from there.
So we also have a question from Mr. Sunil Kumar, who is referring to the IAYT model that you shared, the integrated approach to yoga therapy, where you had mentioned at the Annamaya Kosha level, a practice called ailments. So you want to say a little more about it?
Probably Anandamaya Kosha.
Yeah, the practice related to that level.
So with the Prashanti's or Swami Vivekananda Yoganusandhana Samsthana's model, the faculties and gurus have developed practices for each kosha or each level. So there are various physical practices, prana practices, mind or meditation practices, and the Vijnanamaya Kosha practices. For the Anandamaya Kosha, which is the self or the blissful existence, Dr. Nagendra, who is the chancellor and the founder of Vyasa Bangalore, has developed ANAMS, which is also called as Anandamrita Sinchana, which is a meditative practice to get in touch with the true state or Ananda. So I can only say so much because, again, it is a practice that you have to undergo to experience and learn if you're interested in practicing.
I would like to just read out a comment from Debra, who's been a regular participant in most of the sessions. She says, that is the best explanation of the reasons for acceptance and lack of attachment that I have heard. It certainly is useful in many aspects of life and not just cancer. Thank you. I always associated with coldness, but yes, to separate the self from the disease, which you mentioned, which you brought out, how yoga helps. To separate the self from the disease is helpful to life in many, many ways. So thank you for that.
Thank you.
And
And as I said, I really value that approach because a lot of patients personally can relate to that, and their pain levels immediately drops, and a lot of symptom burden can be managed with that.
so we have a question from another friend, Veronica. I think she's from US or Canada. She has also been a regular participant in most of our programs. She asks, can yoga therapy be as helpful or even more useful to the spouse of the cancer patient that is overwhelmed dealing with the same fears and anxiety as the patient herself? Sometimes the patient does not want to try mindfulness, but perhaps the spouse can find shelter there. Your comments on that?
Absolutely. And definitely, absolutely. With so many patients going through cancer and their caregivers, and especially spouse, of course, other members are affected, but if they're married, the spouse is somebody who's really big time hit by it. And we have had, I have had experiences with many such couples and patients' partners where one of them want to try and the other one doesn't. And a lot of times it's the caregiver who is literally dragging the patient into the session. But as they practice, and something very useful that I found with the couple and caregiver based approach is the ideas of acceptance, appreciation, away from everything, away from cancer, just having each other to appreciate and hold on through the cancer journey could have been very meaningful for all these patients. So I strongly recommend, if you are caring for someone who is going through a life-threatening illness, do yoga for yourself because you want to be stronger, because the patient who is going through the disease is hoping and leaning on you. So it definitely is an area that can be extremely useful.
In fact, if I can add, we had requested Smitha ji to make a presentation and she had proposed two topics. One was this one, and the second preference was yoga for couples in cancer care.
That's right. And maybe there is always more scope to learn.
So we have a question from another friend, Jane, who asks, can yoga therapy also help to predict and prevent the cancer? Like the switch that you were referring to, you mentioned that there are mental factors which act as a switch. So like the switch on the body and the mind to change the situation before it is too late. If yes, what practices seems more effective?
This seems to be a liability question to be answering from US. But to the effect that I have actually personally interacted with many patients who mentioned that they knew they had cancer even before the diagnosis of cancer. And this is actually with many patients who are extremely in touch and well-grounded probably in their physical, mental, emotional spaces. And they're like, I think I had cancer. I went and got a diagnosis myself, which is definitely shocking, but also it just says that in certain level, we are in touch with our physical, mental body, and we can predict and know certain things. But I would not, again, I said it's a liability question because I would not rely on that for the diagnosis or treatment, because how do we guess who is well connected and who can actually diagnose themselves versus who would need a diagnosis? So on the health level, please continue to take care of your health. If you are in an approach with medical care where screening and other factors are available, that should be done. But otherwise, I think the best thing that yoga can help is the preventative medicine. So if we can all practice yoga in its full form, then we can prevent not only cancer, but all illnesses at the mind and body level.
Thank you. We also have a question about pain management, because there's a lot of physical pain also. So is there any way that yoga can specifically help deal with this pain?
Absolutely. In fact, I did not put it up on my screen, but just a couple of weeks ago, some of the colleagues and researchers here in US presented a white paper on yoga in pain management. So yoga has a huge scope in pain management, and a white paper basically refers to recommendations to the federal government and agencies to consider yoga in pain management at an insurance level and a healthcare level and things like that. And when we talk about pain management, it is definitely not limited to cancer pain. It also covers pain like, arthritis pain, back pain, musculoskeletal pain, sports pain, and injuries and things like that. Yoga has a huge scope, again, a lot of breathing, meditative practices, and sometimes the changes in lifestyle correction can also promote and play a role in that. It's an area that yoga therapy can help in, definitely.
Thank you, Smitha, for this wonderful presentation as well as answering these questions so candidly and with great clarity. I'm really, I was touched at a couple of places, especially when you said in the presentation at the end that what yoga therapy can bring in. One is the hope, seeing it as the island of hope. And also from the case study, you mentioned how acceptance came into that person to believe or to feel that even the cancer cells are part of her own being. So I think hope and acceptance are the two great messages of this presentation, what yoga can promise us and deliver us in this field. So thank you very much. I would also like to add that you are part of SVYASA Houston, USA, which is also a collaborating institution for this entire global festival of yoga. May I request you to shed a little more light on the activities of SVYASA Yoga and also tell us about various programs that you're running there.
Absolutely. Before I start sharing some of the work that we do here at SVYASA USA, my heartfelt gratitude to all the viewers who stayed and who had questions and who had engagement throughout the presentation, not just because you are there for the session, but most importantly, because when we go away, the takeaway message is that there is scope for healing at any stage in life and disease, and especially to cancer. So if you know someone who is going through this, it's important that you shed this light and encourage them to take yoga therapy, practice yoga as part of their daily routine. Coming to SVYASA USA, which is the offspring organization of SVYASA Bengaluru. As you know, SVYASA Yoga University Bangalore, the world's first yoga university, has activities in over 30 countries that are actively happening. And US is one of such active places. And within US, SVYASA Houston has been one of the most active centers for the past 2 decades, if not more. And at SVYASA, the work has been carried out in 3 different areas, which is research, where we collaborate actually with MD Anderson for all our research projects. And we have teachers and therapists working with research projects. We also have Stop Diabetes Movement, which is another research project of SVYASA in US that also goes on. We also have community outreach, where we reach into many different parts of the community. We have done projects and outreaches like bringing yoga to juvenile probationary departments, where young children for crimes are locked up in high facility areas, bringing yoga to various temples that are there, bringing yoga to underserved population. There are various projects in terms of community outreach. And most importantly, as a university component, we have, of course, the education field that is going on. We have courses that are run. We have yoga instructor certification program, just like SVYASA Bangalore. We also have a yoga therapy certification program, which is a 2-year program. And as and when our teachers visit, Dr. Nagendraji, Raghuramji, Dr. Nagaratnaji, and many other senior faculties and teacher visit, we have retreats, workshops, and many other activities that are carried on for young children, adult, and for everyone that we can think of. So these are some of the activities that are happening actively in SVYASA USA. We are continuously in touch, and we get guidance and inspiration from SVYASA Bangalore. And something also to mention is the integration of yoga therapy with many yoga organizations across the world. So this was such another platform. And again, my heartfelt gratitude to Vinayji, Anuradhaji, and Team Indica.
So thank you very much. For the benefit of all our attendees and participants here, we have shared the links of both SVYASA Bangalore and SVYASA Houston. SVYASA Bangalore is one of the premier institutes in the area of yoga research, teaching, and therapy. It has a big campus of 200 acres on the outskirts of Bangalore, about 40 kilometers from the city, on Jigani, close to Jigani on the Banerghatta Road, where high-end research are happening with regard to yoga therapy. There is a cancer hospital within the campus. They also have a Ayurvedic as well as naturopathy medical institutions within the campus. So an integrated approach to yoga, health, and medication is being brought about in that institution. So please, if you are interested to know more, please visit the website, and you can also visit the institution whenever you would like to. So with this, coming back here, we would like to ask you if people want to reach out to you or to follow your activities, how can they reach out to you?
My email would be probably the best. Email is smithyoga@gmail.com, which is smithyoga@gmail.com. Of course, we all are on social media now, so you can follow me on Facebook, Twitter, at different places, and I will be happy to share my thoughts or views on yoga therapy applications in cancer care or related.
We also want you to give us a parting message. Before that, I request Srinivasji to present the events of the day. Today in the noon session, we have Ms. Noel Pilia, who will be leading a practice session on distilling joy, extension and opening. So it will be asana practice session, asana and pranayama combined practice session, which will help one to see the extension of oneself and opening of oneself. This will be in both in English as well as in French. And in the evening, we have Dr. R. Balasubramaniam, who is the founder of Swami Vivekananda Youth Movement and GRAM, public policy initiative. He'll be presenting before us what he terms it as enlightened leadership based on the yogic approach to leadership. Professor Dr. R. Balu is a development activist, public policy advocate, author, leadership trainer, and social entrepreneur. One of the finest human beings with connectivity to the ground and a universal vision is the man that Dr. R. Balu is, and he'll be before us in front, presenting us the ideas of leadership from the yogic perspective. So please do join us for all these sessions. And with this, I thank all our participants for being with us, continuing this journey with us. And I now request Ms. Smitha to give us or share us her parting message for the session.
I think the parting message, if I have to say something for all of us, is whenever we talk about yoga, a lot of us are maybe good about talking about it, but the true benefits of yoga lies in definitely practicing it. And I would like to think of yoga as the mother. If you have a mother at home, no one's need is neglected. Everybody's need is met. Yoga is such a mother. If you are looking for that physical fitness, you have it. If you're looking for that mental poise, you have it. If you are looking for that spiritual connection, you have it. And yoga is also the mother who gives you more than you ask with all the love and kindness. So I request all of you to dedicate your time in the practice and in the experience of yoga in living your life as a yogic life. So thank you, Vinayji.
Thank you, Smitha. That was a beautiful expression, I think. Yoga, to see yoga as a mother who goes on giving generously and takes care of every possible needs of her children. Thank you very much. And I thank all the participants. Since there are many questions from the participants about few things, I'll just take a minute or two to respond. For those of you who have joined today or for this session, please know that all these sessions are being recorded and they will be made available on Indica Yoga YouTube channel. So you can always subscribe and watch all these sessions. So far we have more than about 30 sessions and all these sessions are available there To know the events of this entire week, you can please refer to indicayoga.com, our website. You'll get to know the schedule of the sessions that are happening. And to registration, you can also register online through our website, or we will also have links posted on our FB page. So please follow FB page or website or through Indica Yoga YouTube channel to stay connected with all the activities that are happening here. So once again, thank you and wishing you all a wonderful day or wonderful night as the case may be. Namaste.